So why I put Morpheus8 into a treatment plan for patients is for those that have a little bit more aging and laxity into the skin, and I need it to be impressive. I need there to be tightening and lifting along the jawline. I need there to be a couple millimeter lift to the brow. And so it can debulk when those settings are used. And what I mean by that is it can melt fat and kind of a fuller submental. So people that kind of complain about like the double chin, if you will, or have a little bit of like pre-jowling pockets. But outside of that, it's just a deeper reach on the collagen and elastin for people that need something like that. So for patients that do Morpheus8, you'll numb in our office for 60 minutes. That's a game changer at controlling discomfort because this treatment is known to be a little bit bitey, but I am pretty quick with this device. And so a treatment will take about 30-35 minutes. It is very tolerable. And at the end of it, you're going to be red and feel like you have a sunburn because of the radiofrequency heat. That night, that's actually going to have faded out for you, and you'll have kind of a light grain or a little bit of like a tracking to the skin. And then the next day you can put on some light kind of tinted sunscreen after a full 24 hours. And most people feel like it has very little downtime. The one thing I like to educate patients with Morpheus8 is this is really laying a really strong foundation to the skin and aging the skin backwards, but you have to have patience. You're actually not going to see a lot of result after the first treatment. It's going to start to peak after we treat you a second time. And we put these treatments 6 weeks apart, and then we do 3 treatments total, and then about 9 months after your last one. And I've seen it all the way up through a year where the skin keeps improving, but you just have to be patient and give it a little bit of time. But it's a great foundation. And then maintenance is every 9 to 12 months, you would do 1 treatment. A lot of patients are curious about Morpheus8, but they can be a little skeptical. And why it's important to know where you're going and who's providing your service is being able to control your discomfort appropriately is important with Morpheus8. And then also just understanding the settings and how the mechanism of action works with Morpheus to make sure you're either getting the appropriate kind of fat debulking results you're looking for that we talked about, or the skin tightening, or a combination of both. So if you're remotely curious about it, please come see us for a consultation.